Hey everybody, welcome to my channel, Mental Health Importance. In this video, I'm going to explore the different challenges that athletes face regarding mental health and how they have been able to overcome them. Then we're going to talk about the top 10 athletes and their mental health problems. We will discuss an important topic that not many people want to discuss, mental health. Of course, we all know how competitive sports can be, but it's also been shown that many high-profile athletes have had some serious mental health issues. The statistics are alarming. 1 in 3 college students have experienced significant depression, anxiety, or other mental health conditions. Yet among this group, 30% seek help, but for athletes with such problems, is only 10%. These numbers present a daunting challenge to those who wish to improve the lives of our nation's future leaders by creating opportunities that promote wellness and resilience. It's no secret that many people who are well known for their athletic prowess also suffer from some form of mental problems, including depression, anxiety disorders, bipolar disorder, obsessive-compulsive disorder, OCD, schizophrenia, or ADHD. Athletes are people too. They go through the same challenges as anyone else in life and can experience depression at an equal rate to other populations such as college athletes or professional sports competitors. Athletes often carry an epic persona in the public eye, which makes them revered for their courage and vulnerability in dark times because of stressors outside sport, like family issues that might not go away after leaving home. Many athletes find themselves dealing with stress in a high-pressure world of competitive sports. In addition, the unique culture inside sporting environments can often lead them toward feelings that they are not good enough or strong enough, says Dr. Sacco. An athlete might be struggling with mental health and not know it. However, they could show signs of sleep problems, irritability, or low energy, which can indicate a need for assessment to determine what is causing the behavior change, like an increased eating habit without any other apparent cause. There is an assumption that those who play sports can't be weak because they're used to overcoming obstacles in today's society. But this is not truth. According to a new study done by researchers at Harvard University, nearly 1/5 of athletes will suffer from some mental illness. Although mental health services are available, many athletes still choose not to utilize them for fear of how others might treat them. One reason is stigma, namely that those in society view having a diagnosis as being mentally ill, and they want nothing but excellence from themselves. So avoiding the label can bring about some harmful effects, such as diminished self-esteem. Mental health stigmas continue today, even with the advances made by professionals who work specifically within this field. The pressures and expectations on athletes can be enormous. Dr. Sacco believes that these distractions might affect performance in a very basic way, but they are magnified as stakes rise in competition with heightened sense of importance for success. So let's look at some famous faces from sports history who have dealt with these issues themselves. 1. Michael Phelps. Michael Phelps is no stranger to controversy. He was an Olympic swimmer on top of his game with a dominating performance in the 2008 Beijing Olympics, and he became a household name for generations of Americans. This bright spot was brief as he found himself in 2009 photographed smoking marijuana, which led not only him but also his family to be investigated by the police department. Police reported 3 individuals were involved. In 2014, DUI arrest followed a 6-month ban from competition, resulting in depression, anxiety, and thoughts about suicide that finally got help through a rehabilitation clinic located near Phoenix, Arizona, where therapists help treat mental health issues. 2. Andrew Luck. Andrew Luck shocked followers when he announced his retirement just 2 weeks before the 2019 season began. As quarterback for the Indianapolis Colts, selected first overall in the 2012 NFL Draft, It seemed as though his career should have only started at 29 years old with all of that still ahead of him. But now everyone is wondering what will happen next. Luck had been dealing with constant pain and injury for years, but it finally caught up to him. Many fans were frustrated by this setback because they wanted Luck back on the field as soon as possible, even though he needed time off to recover from his mental illness. 3. Ronda Rousey. Ronda Rowdy Rousey is not just any MMA fighter. She has shattered records, winning 6 UFC women's title defenses under her belt. She was heavily favored to win against Holly Holm in November of 2015. She lost when an accidental kick landed on the side of her head, which led to several concussion symptoms from previous fights coming back around full circle at once. Headaches, mood swings, even thoughts about suicide took over again, as if they'd never left. Rousey admitted that there were moments where even though everything felt hopeless, such as being without hope for recovery or having severe doubts whether anybody would ever want her again. 4. Abby Wambach. For years, Abby Wambach was recognizable to soccer fans worldwide as one of America's most successful female athletes. Her international fame and success in this field are matched by her domestic popularity, with more than 10 seasons playing for the USWNT under her belt, including 2 Olympic gold medals and also 6 awards U.S. Soccer Athlete of the Year. However, it was not all about competition. Abby became addicted to drugs after an April 2016 arrest for DUI, where things took a turn into recovery mode. 5. DeMar DeRozan. DeMar DeRozan is no stranger to the struggles of mental illness. He was born in Compton, California, and went on to star for Loyola Marymount University before being drafted into professional basketball at age 19. His status as one of the NBA's biggest stars comes with its own set of problems, like when he revealed last year that not only does depression get him down, but so too anxiety attacks, which can come without warning or even when someone says their name wrong during an interview. 6. Kevin Love. Kevin Love, a 5-time All-Star and member of the gold medal-winning 2012 U.S. Olympic team, he got his first panic attack at 29 years old during gameplay with the Cleveland Cavaliers early in the season this year. He has been wrestling privately over fears that he might be perceived as weak, even though there's nothing weak about being human. And then I saw DeMar DeRozan tweet on how they can use their struggles to help others going through tough times themselves. Kevin Love is worried about COVID-19, but he doesn't dwell on the possibility of getting it. Instead, he worries for those around him that have gotten sick and died. 7. Serena Williams. The tennis superstar Serena Williams has opened up about her struggles with postpartum depression after the birth of her child in 2015. She struggled with feelings of hopelessness and suffered panic attacks as well, living with an underlying fear that she wouldn't be enough for her baby, especially during a time when they needed someone strong most to lean on. Unfortunately, mental illnesses don't discriminate between common or famous patients. They can affect anyone. 8. Simone Biles. Simone Biles is an incredible athlete and world champion. She's also one of the most successful gymnasts in sporting history, but her mental health wasn't always as good. She was sexually abused from age 9 to 12, which led to severe depression until she was eventually diagnosed with ADHD at 11 years old. She only ate a few times per week. Simone has never been ashamed or embarrassed about revealing what happened because she thinks it can help others relate if they've ever experienced something similar too. 9. Terry Bradshaw. Terry Bradshaw is a world-renowned player, actor, and musician. He was the first quarterback in NFL history to have won championships with 2 different teams, Steelers and Broncos. In his 20-plus years as an athlete, on the field and off it, he has overcome depression, substance abuse disorders such as alcohol addiction, insomnia, anger issues, and more. He has helped with therapy sessions that helped him learn how best to manage mental health issues at their roots rather than just masking symptoms. Over time, until they resurface again later down the line, alongside medication prescribed by physicians if necessary. Brad achieved sobriety from these conditions while maintaining faith, too. 10. Clint Malarchuk. NHL goaltender Clint Malarchuk has been through so much in his life, but he never let it get him down. After surviving a devastating injury on the ice that left everyone watching at home feeling shocked and scared for their safety, Malarchuk suffered from post-traumatic stress disorder, PTSD, alcohol addiction, and obsessive-compulsive disorder, OCD. These illnesses can happen if anyone faces excellent emotional upset or shock without getting help quickly enough when there's still time available. Conclusion. These stories explore a broad range of subjects and experiences. The hope is that these tales will help raise mental health awareness, like depression or anxiety in athletes struggling with emotions. The stories of these renowned athletes show that anybody in the world can be afflicted with mental health conditions, like anxiety or depression. People may feel embarrassed about it, but this is not something you should be ashamed of. The athletes are starting to share their experiences with mental health, and it's drawing more attention. The ongoing discussion started by these influential voices has broadened our understanding of the topic, especially in young people who compete hard at a high level for sport like juggling or sportsmanship awards when they show empathy toward other competitors on stage. Mental health awareness needs to be part of what we teach kids so that during competition there will always be someone available if needed. It starts from within. Teaching your child about how strong she can feel through exploring options outside his own limitations. The prominent figures' recovery narratives highlight how essential such professional tools are. We need brave people stepping forward to inspire others. Taking care of your mental problems is essential. It will make you a better athlete, student, and person in general. So take small steps every day by talking to someone who can help, e.g. coaches, making an appointment with medical professionals, or going on a self-care plan like meditating for 20 minutes every day. A Chicago-based nonprofit organization that works to overcome the shame associated with mental health in sports, the Athletes Against Anxiety and Depression, AAAD Foundation, makes strides for self-advocacy programs. They provide workshops focused on nutrition and other resources such as online articles or videos where people can learn about how they cope when it comes to difficult times. Now they can share their story without feeling embarrassed because others out there, like themselves, understand what goes through your head during these moments of distress. Athletes for Hope also helps connect athletes, so they have someone else caring enough about them too. Subscribe and turn on notifications so you don't miss more videos of the importance of mental health and much more. Check out other videos about mental health, and I'll see you in the next video. Take care.